Okay, I'll just wait for it to come up on my screen, if that's okay. Yes, there we go, thank you. Okay, Prynhawn Darker ISO, good afternoon. Welcome to the Merthyr Tydfil County Borough Full Council meeting on Wednesday, the 2nd of February 2022. Please note that this meeting is being recorded and may be broadcast via the authority's internet site. The images and sound recordings may also be used for training purposes within the authority. So agenda item number 1 is apologies for absence.
Mr. Mayor, I don't think we have any apologies. I think the only person who may not be present is Councillor Darren Roberts, and we know that he is on his way.
Yes, I can see Councillor Roberts is arrived now.
Yes, thank you, Mark.
Okay, item 2 then is declarations of interest. No one is indicating, so we'll move on to agenda item number 3, which is a presentation from the Kumtak Mcgowan University Health Board. So I'll hand it over to you guys, please.
Thank you, Mr. Mayor, and good evening, councillors. Nice to be here with you. My name's Paul Mears and I'm Chief Executive of Kumtak Mcgowan Health Board, and I'm joined today presenting to you by Greg Dix, who's our Director of Nursing and Midwifery, who is going to do some of the presentation alongside me this evening. It's really good to have the opportunity to come along and talk to you about a number of the things that are currently in focus with the Health Board, and many of you, I'm sure, will have some questions at the end to ask us. So we have a few slides to go through, and then we've got time for questions at the end. I thought I'd just start off by sharing this slide with you, which is basically a recent development in our organisation of pulling together our thoughts about what our strategic goals are for Kumtak Mcgowan Health Board. So we have 4 strategic goals that we've recently agreed with our board, one of which is creating health. So looking at how can we reduce health inequalities in our communities that we serve, focusing on mental health as much as we do on physical health, making sure we support our communities, and particularly looking at how we work more proactively with voluntary sector organisations and communities to support improving health and well-being in our towns and communities. And also, as a large employer across our patch, we employ 13,000 staff. We obviously want to make sure that we are a healthy organisation, that we encourage our staff to have healthy lives and support their health and well-being, and that's been particularly relevant over the past 2 years with the challenges that all of our colleagues have had in managing the response to the pandemic. Obviously, another key goal for us as an organisation is improving care, making sure that we're continually looking to improve the safety and quality of the care that we provide to our patients, but also thinking about how we can deliver care in a different way and providing different models of care. So looking at how we can develop alternatives to hospital care, providing more care in the community, in people's own homes, but also working with colleagues in the hospital settings to make sure that we're looking at how we can deliver services differently, particularly thinking about how we use technology more to provide services. And again, that's an area which has really been a focus for us over the past couple of years. As the pandemic's hit, we've had to switch very quickly many of our services to digital and online services, and there's something for us in this about how we maintain and develop that method of working moving forward. And also making sure that we have a timely access to care. We're very aware that for many of our communities, getting access to care is the most important thing. So being able to get an appointment with your GP, being able to get seen quickly in hospital when you need something, being able to get a test or an x-ray or a scan when you need it quickly is really important to our communities. And we know that given the pressures we've been under over the past couple of years, that hasn't always been the case. So we need to do more to improve as we look to come out, hopefully, of the COVID pandemic. How can we improve access and make sure that we can get care to patients in a much more timely way? We also want to be inspiring our people, and that's not just people within our organisation, but inspiring people in our communities. So we want to make sure that the leadership in our organisation is open and transparent and visible to all of our staff, and making sure that we are promoting, obviously, diversity and inclusion of all of our staff groups and communities within the workforce at CTM. We also want to make sure that we think about how we can work with local communities to encourage employment opportunities for local people. We're a very large employer, as I said earlier, and we're very aware that there are great opportunities for us to do more to proactively encourage people from our local communities, our young people, into employment within the Health Board and to careers in the NHS, and to tackle some of the big challenges we have in terms of workforce, which are very real for us in CTM. Finally, the final goal is sustaining our future, making sure that we're doing everything we can do to create a more green organisation, working towards reducing our carbon footprint and tackling some of the challenges we have as a health organisation with large amounts of waste, particularly things like single-use plastics, some of those challenges, but also thinking about how we can use renewable energies much more actively across our organisation. And this is an area we're working very closely with colleagues from the local authority on. We've also got to make sure that we are sustainable financially. There are some big challenges ahead of us, as with the whole of the NHS, in terms of high levels of demand coming through for services and a limited pot of resource to resource that with. So we've got to think differently about how we use our money and provide the best value in care that we can. And finally, making sure that our estate and our facilities are fit for the future. And many of you will know there's a significant programme of work currently underway at Prince Charles Hospital to improve the facilities there. And that's one of the largest estate redevelopment projects in Wales now, which is, I think, really positive for Prince Charles and for Merthyr. But we know also there are other facilities across our estate that we do need to focus on improving and developing so they are better equipped for the needs of the 21st century. So if we go on to the next slide, just to give you a quick overview of what we're going to cover today. Obviously, I'll touch a bit on COVID and our vaccination programme. Greg will then talk you through some of the work that we've been doing on improvement at Prince Charles Hospital, particularly around our emergency services at the hospital. He'll also be able to give you an update on maternity and neonatal services, and then we'll update you on some of the work we're doing in mental health and also our plans to try and recover the position on our elective waiting list pressures. So if we go on to COVID, obviously we've been living and breathing COVID now for nearly 2 years, and having been in the Health Board now for 18 months as Chief Executive, it has felt very much that we've all been really spending most of our time dealing with COVID. We've had a great, I think, experience of working in a joined up way with colleagues in the local authority, across all 3 local authorities, and the response to COVID has been very much a multi-agency response. The work around TTP, test, trace and protect, has been done in a very joined up way with the local authority colleagues. But as the slides say, we've had huge amounts of work going into testing. The testing is now becoming more stable. The demand for our testing services is becoming more stable as the amount of COVID in the communities is beginning to recede again. But we do need to make sure that we maintain that testing capacity, because obviously we still are slightly uncertain about how the COVID pandemic is going to pan out over the next few months. So we need to make sure that we maintain that testing capacity. And linked to that is obviously how we provide contact tracing after people have had a positive test, and making sure that we are able to contact people and track any contacts they may have had. We're also working very actively on how we work with surveillance, making sure that we're keeping track of where pockets of infections are still popping up, because we know there are still clusters of infections that can occur, particularly in areas such as schools or workplaces. So we've got to keep an oversight of that. But it does very much feel that we are moving towards managing COVID now as an endemic disease within our communities, rather than a pandemic response, which in some ways is a positive thing, but it does mean that we absolutely can't take our eye off the ball, and we do have to keep monitoring very closely, because as we saw with the Omicron variant just before Christmas, very quickly new variants can take hold and produce a huge range of challenges for us. On to the next slide, please, Richard. Positive news, I think, and you will have all been experiencing this, is the uptake of our COVID vaccination programme within CTM. As you see there from the numbers, we've had a very high rates of COVID vaccination across our patch. 94% of our communities have already had their booster dose. 80% have had their booster doses, 96% of people have had their second doses, and 88% have had their first doses. So a high number of people have come forward for their vaccines. And we've been really trying to make sure that we still get to our particular populations that perhaps have been less likely to get vaccinated. We've had some very targeted interventions in particular communities, such as the homeless communities, particular ethnic groups where perhaps take-up have been lower. We've had quite an amount of work going on to particularly now pick up those small groups of people that perhaps have been a bit reluctant to come forward for their vaccinations. I have to say, staff at the organisation in the health board have been fantastic in the run up to Christmas, where we had to ramp up the booster campaign. We pulled staff in from all sorts of different parts of the organisation, trained people up very quickly to get the booster campaign up and running as quickly as we could. And again, colleagues from the local authority were hugely helpful in terms of the facilities and the support at the sites to make sure that we were able to get as many people through those vaccination centres as quickly as we could to get the boosters in people's arms before the end of the year. We're also now looking at how we can trial new ways of delivering the vaccine in different places. So we're starting down at Spitty Serin in Bridgend, a drive-through vaccination service for there. We're testing that model there to see how that works. And moving forward, as we start to, as I say, manage COVID as an endemic disease, we need to think about how we also plan for vaccination probably becoming a more regular occurrence for COVID, in the same way that flu jabs are now an annual occurrence for everybody in at-risk populations. So we're beginning to work through a plan of how we develop a vaccination service that is not just about COVID, but may also include flu vaccinations, other immunisations, and thinking about what the workforce needs will look like, but also what the facilities we will need to have to be able to provide that to our communities. Right, I'm going to hand over to Greg. That's what I was going to say on COVID. Greg, I thought it'd be useful if you perhaps would take colleagues in the council through the PCH Emergency Department Improvement Plan.
Of course, thank you, Paul, and Prynawn da pawb. Good afternoon, everybody, and thank you, Mr. Mayor, for the invite this evening. I'm going to take us through a couple of slides, starting off with the Prince Charles Emergency Department programme. Back in the summer of last year, through our quality and safety surveillance mechanisms, we identified a number of issues related to flow within the ED at PCH, some issues related to infection prevention and control, and specifically some staffing concerns. Through our regular interactions with Health Inspectorate Wales, we raised these issues which we'd come across, and equally to the board. And then in September, HRW undertook an unannounced inspection of the emergency unit and clinical decisions unit over a 3-day period, starting on a Monday evening. Quite a few concerns were escalated by the inspection team, fairly similar to our own observations, although it was incredibly disappointing, and we had started the improvements already, but this definitely escalated the work we needed to do in relation to raising standards and how we could better support staff at that time. It was in between COVID waves, so we were equally challenged to ensure that we had separate pathways for non-COVID patients and separate pathways for COVID patients within an environment that is very challenged in relation to space and capacity. We took to the board a detailed improvement plan. The executive lead from an operations perspective is our Chief Operating Officer, and I lead the clinical input within my role as Executive Nurse Director and lead for quality. We set off on our improvement journey, which was multi-professional with weekly oversight, until we were satisfied that some of the make-safes were embedded within the service. And just last week, we had a follow-up week before, sorry, a follow-up unannounced inspection from HIW. So 3 weeks following the initial inspection, and I'm very pleased to report the positive feedback we received and some really nice commentary from the inspectors describing it as being one of the best improvements they've seen in the middle of a pandemic. And equally, the sustainable actions continue to be within the service. We've not had the formal report yet. That should come out in a month or so. So lots of activities within PCH. I'm equally pleased to update council members that we have increased our staffing levels from both a medical and a nursing perspective within that unit. Next slide, please. So as well as focusing on urgent care and ensuring that patients are offloaded very quickly from the ambulance to our emergency unit, we've equally been working through our elective recovery programme. So we have many patients that have not been able to access our services in a timely way, associated in the main to the 4 COVID waves we've had. In between the COVID waves, we have initiated elective surgery, and then regrettably we've had to take that down when transmission levels have excelled within our communities and numbers of patients within our acute hospital. So there's 4 key components to our elective recovery programme. So inpatient and short stay elective surgery. Again, in order to do that and in order to ensure the safety of our patients, we have segregated pathways within all of our acute hospitals. Primary care, so a very extensive recovery programme around primary care, access to GP, nurse practitioner services, outpatients and diagnostics. The scale of this challenge is huge, and the board's working really hard in ensuring that there's just as much attention now on ensuring we have a very sophisticated elective recovery programme and ensuring that our communities understand at which juncture they will be able to access our services, and a lot of focus on patients with cancer diagnosis also. In order to ensure consistency across the health board, Paul commissioned a centralised approach to elective recovery. That's now underway, led by one of our very experienced directors, and clearly we'll be working, and we have been working with local authority colleagues over the coming months. And next slide, please, Rich.
Thanks, Greg. I was going to pick up the next slide, which is just touching on the mental health, and then we'll come back to the maternity work. Just to give colleagues an update really on mental health. Clearly, you know, as a health board, we've got a really clear focus that we want to ensure that mental health has an equal priority as physical health does. And as many of you will know, the pressures in mental health services have been significant, particularly during the pandemic, across all the age ranges of our population. So again, it's on a light very much on the need for us to make sure that our mental health services are as comprehensive as they can be. As Greg mentioned, part of the improvement work at PCH has been also looking at how we bring mental health services much more into the day-to-day operational business of the hospital at PCH. Clearly, people with dementia, for example, will need to be admitted at time for physical health issues. And I know we've had some challenges in our way of being able to care for patients with dementia in PCH in the past, and our mental health specialist nurses are now very actively working with our mainstream physical health nurses, if you like, on the wards to try and make sure that both the care we provide for our patients with dementia is as good as it can be, but also that the physical environment is as good as it can be for patients with dementia, because it's really important for patients with dementia that the physical space that they're in is as comfortable and as less stressful as possible. So there's a lot of work going on, led by one of our lead nurses in mental health up in North Cunham, to try and bring that standard much more up to where it needs to be within Prince Charles Hospital. Part of that is also about a liaison service, making sure that we've got good relations between the specialist services that are down at YCC, Ysbyty and Prince Charles Hospital, and we've been putting in place more resources, more equipment for the teams to improve and upskill the teams on the general wards. And also making sure that where we have patients presenting at ED emergency department at Prince Charles, that we've got adequate resources in our crisis team. We have a number of patients who obviously get into crisis with mental health problems who will turn up either in an ambulance or self-present at the emergency department, and it's really important that we've got the space, the staff and the skilled experts in the crisis function to be able to pick those patients up if they arrive in the emergency department, and make sure they're cared for in an appropriate way that meets both their physical needs and also their mental health needs. We're working very actively now also to roll out the Wales-wide dementia standards. One of our senior nurses is leading that rollout across the health board, and we're working very actively on the dementia-friendly hospital charter to make sure that, again, all of our hospitals, and including Prince Charles, is brought up to that standard. And as it says there, we're also doing a lot of work to skill up a general level of understanding for all of our clinical staff in how to care for patients with dementia, because as we all know, this is an illness that is affecting many more of our population. So it's really important that everybody across our health board in clinical roles knows how to deal with and care for patients who have dementia. Next slide, please, Rich. The other really positive development for in mental health, and many colleagues may well know about this because it's very much a joint project with the council in Merthyr, is the development of TNVIS in the Keir Hardie Health Park. And this is a service that was jointly run between the health board and social care in the council for a number of years, but was run in a very separate way between health and social services. And back in 2019-2020, we worked very closely with the council on developing thinking around how we could improve that service within Keir Hardie, and the work that we undertook showed that the environment there really wasn't conducive to caring for patients with dementia. The model of care was complicated and wasn't very joined up between health and social care, and it was difficult to access for patients and their families. Next slide, please. Now, I think we can all be really proud of the facility that we've got up at TNVIS at Keir Hardie. Having been there myself and seen it, it's a really amazing facility, a lovely place for people to come and spend time, be looked after by a joint health and social care team in a really, really home-like environment. It's a very homely, it's, you know, for a health facility, it really doesn't feel like a health and social care facility. It really does feel like a social environment in somebody's own home. It's been fully funded by ICF funding through Welsh Government, and has been really built and developed in line with best practice and evidence on what good dementia care looks like for people. And we've got a really good joined up way of working now between the health board and the council to ensure that anybody who needs to access that service is able to do that. And only this last month, they gained a new level 1 meaningful care matters accreditation, showing that they are providing really high quality care for patients with dementia. So I'm really pleased that we've been able to jointly with the council develop that service to ensure that patients with dementia who need day care and support respite care can get that now in the local area in a really great facility. So that's a really positive example, I think, of how we're working together with colleagues in the council to improve services for our local communities. And leading on to that conversation about working with local authorities, I think one of the really benefits, bizarrely through COVID, there have been benefits from it, and one of those is that we've been able to develop, I think, a really strong relationship now with local authority colleagues. We've worked really closely with Ellis as chief exec and Lisa as the leader over the past 2 years, really looking at how we can work together on the COVID challenges. But I think what that's also given us the opportunity to do is to think about what other things we could be doing more jointly across health and local authorities. And we've got some good opportunities, I think, to think about how we can develop some of that work in things like health and social care integration, how we can focus on some of the health inequalities issues that we know are very real in our communities, but also how we can share information and data between health and social care, for example, to make sure that we have collective understanding of what's going on with a person at any point in time and wherever they access services. And there's some really good already joint working between our operational teams in the locality, and particularly focusing on the hospital at home model that has been already trialled over in West Wales and Hywel Dda Health Board, looking at how we can develop more joined up working across health and social care teams, bringing together housing associations into those conversations as well, to make sure that we really are looking at the whole range of services that support people in our communities, so that wherever possible we're keeping people well in their own homes, and trying to reduce the need to bring people into hospital, or indeed move people into long-term residential care or with high cost placements. Come to the next slide. And so finally, I'm just going to hand over to Greg to give an update on the maternity and neonatal work that's been going on within the Health Board for quite a while now, and Greg has been involved in since the beginning. So over to you, Greg.
Thank you, Paul. So we've just entered our third year in relation to our improvements around maternity services, and within the last year, neonatal services only. The original report published by the Royal College of Obstetricians and Gynecologists and the Royal College of Midwives set out 70 recommendations for the Health Board to achieve. We've secured 55 of these recommendations, which are both verified and validated by the Independent Maternity Services Oversight Panel, and 10 of which of these 55 we continue to ensure that we have good assurance mechanisms around them. The remaining 15 recommendations are generally all related to the work around our values, behaviours and culture as an organisation. The last report published by the independent panel was last October. So that was the 5th progress report since the inception of the improvement journey. The report was really positive, highlighting lots of progress against the COVID backdrop pandemic, and some staff absenteeism, both when we were required to release some of our improvement team to go back to work clinically, but equally staff affected by either having COVID or being contacts of COVID. So the recognition of the impact of the pandemic was very clear within that progress report. There were 3 clinical reviews that the independent panel were keen to progress with. The first was maternity, morbidity and mortality, and that was published a year ago now. The second was a clinical review into stillbirths, and that was published the same day as the progress report last October. And the final clinical review, which was in relation to neonatal services, will be published towards the end of April of this year, although the next slide I'll talk in a little bit more detail in relation to the work that we progressed from a neonatal perspective. With all of these clinical reviews, the findings were nothing different in relation to what the original findings were within the Royal College, and of course the majority of those original actions have all now been delivered and assessed through our assurance framework. Next slide, please, Rich. Has the slide moved on? Sorry.
Not yet, no.
Oh, lovely, thank you. So last April, May time, during the improvement work we were undertaking from a maternity perspective, we undertook some reviews in relation to our neonatal service, and at that juncture felt we needed to have some independent oversight and review in relation to some of the areas that we'd highlighted, which was around medication prescribing, elements of documentation, how we access tertiary support, and how we ensure that the breathing tubes that support babies are kept intact at all times. So we jointly commissioned an independent review with the Independent Oversight Panel. And that happened late spring last year, and during summer we received our initial report, which outlined some of the concerns that we'd outlined ourselves, but equally some recommendations for future practice. And that review, it says on the slide, will be published January. In fact, we've had a later update, which we now know that review will be published on the 10th of February. So what we've done in relation to some of the concerns highlighted around neonatal services, so we expanded our maternity improvement team into neonate. So now the programme is run very much collaboratively with our obstetricians and our neonatologists and our midwives and our senior neonatal services. So I still maintain board responsibility for maternity, and our deputy medical director, who's an obstetrician and gynecologist by background, she's leading the neonatal element. But it all comes together under the governance structure of a maternity and neonatal improvement board. We've reviewed our staffing levels across the service and equally ensured that we have more consultant time, so paediatric and neonatologist consultant time within the unit, doing much more work collaboratively with our Bridgend special care baby unit. And we have more pharmacy oversight within PCH, and we've accessed some really supportive help from Swansea Bay, from their tertiary unit, and equally from Cardiff in relation to neonatal nursing expertise. And we've changed lots of practice and guidance in relation to ensuring that all of our medical devices are secured as well as they can be. So we'd identified these concerns through our own governance and surveillance processes, and we were very grateful for the support from the external panel that led us down a track to ensure that there were further recommendations we needed to make sure we put into practice. Next slide, please, Rich. Oh, sorry, yeah, and that was my final slide, so thank you very much.
Yeah, thank you. That was a very interesting and informative presentation, and I'm sure members have got some questions for you. And indeed, Councillor Clive Jones has a question.
Thank you, Mr. Mayor. I have two. I understand that due to the enormous waiting list throughout Wales of, I think it's just under 600,000, that each health board and trust were required to submit an action plan to the Welsh Government. Has your board submitted that? And if so, when will that action plan start? And I fully understand the problems and issues you've had coping with COVID-19 and the effect that that has had on the staff.
Thank you, Councillor. Yes, we have, as you say, submitted an action plan. Earlier last calendar year, in the autumn, we were asked to submit a plan to Welsh Government, and we have been able to. Welsh Government also made some money available to health boards across Wales to support the recovery of surgery and elective activity. Unfortunately, as you'll know, we had these plans in place. We started to ramp up our activity again, and then of course the Omicron variant hit just before Christmas, so everything then had to get stood back down again. So we're now just in the process of revisiting all of those assumptions that we made just before Christmas, and are replanning our scheduling for that. But it includes things like, for example, bringing in mobile endoscopy capacity, so endoscopy units that can be put on the lorry effectively and driven around. We're having one of those that will be brought into the health board at the end of this month, so we will be able to increase the capacity in endoscopy be. We're looking at how we can deliver more elective cataract operations by trying to bring our ophthalmologists more closely together in one place to get more volume of work going through. So we've got a big plan of action. You're right, it's hugely complex because it isn't just about people, it's also about the capacity and the theatre space and the bed spaces to accommodate that. And Greg mentioned earlier, one of the other big challenges we still have though is keeping COVID and non-COVID patients separate within our hospitals, and that's equally the same in our elective operating processes. And we have big challenges. You know, even just before Christmas we had a plan to start up elective orthopedics, and one of our surgeons got COVID, and so we had to literally stand down everybody on the day because the surgeon went off sick. So it is a big challenge. We have a lot of people working on it, and it's an area where, in fact, we're just planning a briefing session for local authority leaders and others in the next few weeks on the scale of that, and that's something perhaps at a future meeting we'd be happy to come back and give a bit more detail on to full council about what we're looking to do and the sorts of things we're aiming to do to catch up the backlog.
Thank you. My second question is in relation to the building project that you have at Prince Charles Hospital at a cost, I think, in excess of £120 million. That I know was planned for a few years. How far are we through that improvement plan, and when do you anticipate that the work will finish completely? I'm aware I've visited Prince Charles site last week, and I know the hospital's in the middle of what is in effect a building site there.
Yes, you're absolutely right, and it's a real challenge trying to make the level of change in the physical environment in a live environment where patients are still being cared for and visitors are still coming in and things. So so to answer your question, we are now moving to the second phase of this. So there's been a big program of work on or underway over the past 18 months, 2 years really, and now we're on the ground and first floor plan. We're just, for example, looking at how we re-provide and develop the new intensive care facility, for example, and more theatre space and bed space there. The timings are quite long because we're working in the live environment. It does mean we have to decant people out of one space to free it up to enable us to get in and do the work. So we're just in the process, for example, of decanting a number of people out into temporary buildings on the site so that we can free up the space. The exact time frame, I think it's a long time. I think from memory, it's 2025. Is when the last piece of work, but as always these things are subject to change, and we've had some particular challenges given some of the global challenges in construction at the moment and supply chain pressures. That has led to some delays on certain elements of the programme, but we are very aware that whilst the end product will be a really much improved hospital, in the meantime it is a really difficult thing for staff and patients to manage. But unfortunately, you know, we're just recognising we're going to have to work around that whilst we get through this.
Thank you.
Thank you, Councillor Jones. Councillor Chris Davis, please.
Yeah, thank you, Mr. Mayor. Paul, Greg, Rich, it's lovely to see you. Thank you for joining us. I just want to put my thanks on record to the amazing work that nurses, doctors, managers have done across the pandemic period. And it was lovely to see your piece about TNVIS and the joint work that the local authorities done together, and I hope to do further work now on the Learning Disability Day service as well. So I've got a couple of questions for you. I'll focus on 2 questions around A&E services first, if I may, Mr. Mayor. Greg, I'm pleased to see that you've had a further unannounced HIW visit in a relatively short period of time. But obviously Wales Online weren't particularly kind to you on the 16th of December because the headline was staff struggling, Welsh A&E, staff in tears, ashamed to work there. So that wasn't good news, and that was a headline taken from that report. I know the HIW report itself talked about a patient having a miscarriage in the public, in the corridor of Prince Charles, in the view of others. Well, I think, you know, I'm looking for and members is reassurance. How are you going to ensure that you monitor and continue to keep reviewing the pressure and demand on A&E services, and you have absolutely the right staff and structure to support that, so it doesn't get back to where it was, you know, during this period of HIW, so easy from one day to another in such a high demand area. You know, services at the front door of Prince Charles Hospital have not been acceptable, have they? So it's great to say how quickly you've turned things around, but how are you going to ensure that you continue to keep those standards, you know, where they need to be?
That's a great question, Councillor Davis, and thank you for that. I guess the success of the front door will be the success of our back door of the hospital also. So, you know, we do have, you know, numbers of patients waiting within PCH for all different types of onward care. And we need to work at both releasing some of the capacity within the hospital from a discharge perspective to release the pressure from the emergency unit for onward flow to the hospital. So we, as part of the improvement programme I was describing earlier, we're focusing all of our efforts equally from both an offload ambulance delay perspective to ensuring that the 4-hour window within ED, so the 4-hour target, is very much aligned to releasing then capacity for patients that need to be admitted into the main hospital into beds which we can free up for patients that need onward care in the community. So so it's been really, I was on call last night and I was up a lot supporting the system in relation to numbers of ambulances, you know, queuing up, waiting to offload within ED. I think we've changed, well, I know we've changed lots of the processes within the department itself, increasing both nursing and medical capacity, not just in numbers, but the times of the day certainly has really helped our minor walk-in patients. So patients, you know, ordinarily could be potentially cared for within primary care, but for many reasons decide to attend our ED up in PCH. So it's a multi-prong approach, Councillor Davis. You know, we were really distressed to see those headlines on the 16th, and we need to ensure that we offload patients in a timely way to the emergency unit, and sometimes that means we are crowded, but of course we need to release ambulances back out onto the road to support people in the community that need 999 calls. So we try and look at this as a system-wide approach and concentrate on both the front door and the back door in terms of releasing capacity for flow throughout the system. I hope that answers your question.
Yeah, Mr. Mayor, thank you for that. Greg, thank you so much. It leads me on really to my second question. It's almost like you've got a crystal ball, or you've read read my questions. You know, it's fair to say though, you know, Prince Charles Hospital, and obviously that's what this council's concern is, because obviously it's our district general hospital that covers the communities of Merthyr Tydfil. You are far from falling short though of all of those standards of ambulances offloading, you know, moving patients flowing through the hospital in 4 hours. We hear horror stories of people, you know, waiting. I know a constituent in my ward with a dementia who waited almost 18 hours in an ambulance in Prince Charles only a few weeks ago, you know, having suffered a TIA, to be seen and pre-triaged. So I appreciate the pressures that all the NHS is under, but that is far from acceptable. I have real concerns about the capacity of the A&E department of Prince Charles Hospital to cope with the demand, particularly since the downgrading of ED services at YYF, Ysbyty Ystrad Fawr in obviously Ystrad Mynach, which is part of an Iron Bevan Health Board. Also the closure of the A&E services at Neville Hall, which has meant, you know, that patients are coming now, particularly by ambulance, from the Welsh Ambulance Service Trust, being conveyed to Prince Charles, not being conveyed to the Gwent or to the new centre at Llanbechfa Grange. I understand that Prince Charles Hospital is a major trauma centre, but I want, I think members here need reassurance, Paul, from you this evening. And I am surprised that the chair of the health board isn't here with you tonight as well to, to come and present to members, because that was part of the request. But I think we need reassurance that, you were having conversations with your counterparts at Aneurin-Bevan and at Powys that patients should be going to other hospital provisions and not being conveyed by ambulance or other means to Prince Charles, and that they are accessing the appropriate non-trauma health facilities in their own health board areas that are not taken away from the services that the communities of Merthyr Tydfil and Upper Rumney Valley and Cynon Valley need and deserve.
Thanks, Councillor. Yeah, and sorry, I should have given Emrys his apologies at the beginning of this meeting. He's unfortunately on holiday this week and isn't unable to attend. Yeah, just to reassure councillors, absolutely, we are working very closely with our neighbouring health boards to track and monitor the flows of patients that are coming from our neighbouring areas. So as Councillor Davies rightly says, we have a number of patients. Prince Charles Hospital obviously serves the community of Merthyr Tydfil, but we do have patients coming from Powys, at local health board area, and indeed Aneurin-Bevan Health Board, and as you rightly say, Councillor, there have been changes in the past year or so with the opening of the Grange Hospital in Cwmbran, which has led to Neville Hall no longer providing A&E in that location. We do monitor the flows of patients and where they're coming from, and actually, interestingly, we have more of a flow from the Powys patients than we do from the Aneurin-Bevan Health Board area. Though we have had a very marginal increase in Aneurin-Bevan patients coming to our hospital at Prince Charles. So what we do with that, we have mechanisms in place to have the conversations with the neighbouring health boards. There is a contractual mechanism as well to make sure that where patients come from other health boards into our area, that's funded by their own health board, so we get resource for that. But we do make sure that when we're planning our services, particularly around Prince Charles, that we are taking into account the flows that are changing and making sure that where those flows go beyond what we're expecting, we have active dialogue and conversations with the neighbouring health boards. I should also say it's not just about the challenges that presents in terms of demand coming to the front door. It also can be difficult then when a patient from a neighbouring health board is admitted, trying to get them back to their home with a local authority that isn't one we're used to working with. That can prove difficult as well. So it is a challenge, but we've got to try and make sure that we are supporting those patients, particularly those that live in the natural catchment area of hospital at PCH. But to reassure you, it is something we track regularly and have active conversations with our neighbouring health boards about.
Great, thank you, Paul. Mr. Mayor, I know there's a number of other members. If you could just indulge me with just one further final question, and I'll give way then to the other three members who wish to speak. Is that okay?
Yes, if you make it a quick one, please, Councillor Davies.
Yeah. Okay, thank you, Mr. Mayor. So again, Greg, obviously you spoke about the work being done in respect of maternity and neonatal services. Another headline from the 7th of September reported by BBC Wales was immediate improvements must be made to neonatal services at PCH. I think you had two leading experts who undertook an investigation into neonatal services at Prince Charles Hospital. Obviously, this work is against the backdrop of obviously maternity failings identified in 2018, and work began by the improvement overview panel in 2019. And obviously the health board will put into special measures. Two questions for you really. The first is what more are you doing to urgently address those concerns that were expressed back in September about immediate improvements needed to be made? And do you agree for the communities of Merthyr Tydfil, this is a worry? Prince Charles Hospital is a major birthing centre, and what are you doing as a health board to reassure families and residents in Merthyr Tydfil and the health board area generally about it's safe to come and have your baby at PCH?
Of course, thank you, Councillor Davis. I'll take the first question. So as articulated in my slide deck, when we, through our quality surveillance mechanisms, we identified some concerns within neonates, and then jointly commissioned the review, and the headline on the 7th of September was as a result of the initial findings. So some of the immediate make-safes were centred around medications management, extra pharmacy support, a review of consultant rotas, support around medical devices and staffing. So all of the make-safes were undertaken very quickly and are monitored through our assurance framework. So I can assure the population of Merthyr Tydfil and councillors here today that the unit is safe, and we have many checks and balances in place to mitigate any particular risks. In relation to reaching out to our women and families that use both the maternity and neonatal services, we've undertaken a lot of engagement events. In fact, we had one in Merthyr pre-COVID actually, and in other parts of the health board. We equally have a user forum called My Maternity My Way, which compiles of both women that have had babies within the health board, some a good experience, some not, and equally some dads are part of this forum. So there are 80 individuals, all from the Merthyr Tydfil and slightly wider area, supporting, and rightly so, constructively and challenging all of the improvements that we make and continue to make within the service. So there's lots of engagement. We have many different social platforms for women and families to engage with us. And equally, and we share the concerns that still come in. We share our improvements in practice. And through our work with the Independent Maternity Oversight Panel and Welsh Government, we have a specific work stream for women and families. And we've just reached the maturity stage in relation to some extra validation and verification that, compared to where we were several years ago, the engagement is much more sophisticated than what it could be. Obviously, we'd like to do more, and it has been challenging during COVID. But certainly from a visiting perspective, but the My Maternity My Way Women and Families user group is very active, and we have very close connections with that from to ensure that our services are excellent in relation to the provision of care, and in fact we just have an active consultation out currently seeking the views of women and families across the Merthyr area on developing our vision for maternity and neonatal services going forward. Thank you.
Diolch Paul, diolch Greg, thank you Mr Mayor.
Okay, thank you, Councillor Davis. Councillor Bill Smith, please.
Thank you, Mr Mayor. Paul, can you tell me what's happening with the hospital to home service? Because with the funding changing now for the Welsh Government this year, starting in 1st of April, it's massive changes, and there's a need for this because we're going back to the older persons back into home, and also we stop the bed blocking.
Yeah, so as part of the work being done through the Regional Partnership Board, the transformation funding that was supporting a number of the out of hospital work, so the Stay Well at Home service, which was the joint agency team that was looking to keep people well in their own homes and support people to get home quickly from hospital. That's been a real success for us up in the Merthyr locality. That funding is going to continue through. We've had confirmation from Welsh Government that money will continue. However, it will be tapered over a number of years, so that we will need to look at how we mainstream that within our own services. We are just doing a piece of work as a health board, and we'll be obviously working on this jointly with the council colleagues, looking at what does that model need to look like in the future. So if you like, we've trialed that model for a few years now, and lots of it's worked really well. There are some further things I think we can do more to develop it. I think there's more we can do to support people to be independent in their own homes through enhancing that service. But we also, as a health board, see it as very much part of our strategy moving forward to try and move our focus away from hospitals to try and encourage more of our people to be able to be supportive in their own homes, because that helps them with the pressures on the ambulance service, it helps with the pressure on the emergency departments, and it means that people, when they are going into hospital, we want to be able to get them home as quickly as possible. So it's done some really good work so far, but there's more I think we need to do, and it forms part of the conversations also about where we go next around our conversations around health and social services integration.
Paul, Mr. Mayor, can I come back? Paul, there's no time limit to this now, is there? Time scale, because we've got staff working now with older persons on this policy, and if we don't sort things out, there could be a bit of a redundancy, and that's what we're concerned about, as you know.
Yes, that's absolutely true. There was some concern until we'd received the confirmation from Welsh Government that the funding was going to continue, that the funding would run out at the end of March this financial year, and that would leave us potentially with some liabilities around staff that may not have jobs. That worry has been removed from at the moment, so that's really helpful. But as I said, the money isn't forever. It's going to taper down over a number of years, so we will still need to work on how we make that funding sustainable from within the health board's resources moving forward.
Well, thank you very much.
Thank you, Councillor Smith. Councillor David Isaac, please.
Thank you, Mr. Mayor. My original question has been basically asked by my ward colleague, that of the impact of the Grange Hospital on Prince Charles. So I'll ask a secondary one. It is the opinion of many people in the Merthyr area that Prince Charles is now too small to cope with the influx of people from Aneurin Bevan and South Powys. Are there any plans for the hospital to expand bed capacity? And whilst expanding bed capacity in specialised areas, would you consult with staff before the build, as I am aware there are drastic flaws in some of the areas that have been built? That's the first question.
Yeah, absolutely. We want to obviously make sure that the facility is redesigned and can manage the demand that we expect to see through the doors. As I said earlier, we do look at the volume of patients who are coming from neighbouring health boards to make sure that we are planning that into our assumptions moving forward. Some of the work that's going on as part of the redevelopment at Prince Charles Hospital is designed to try and increase capacity and look to how we can make more of our space available for emergency care particularly, but also, as I said earlier, looking at our theatre capacity and our surgical capacity as well. So it is something we keep under constant review, but it also needs to be looked at within the context of the wider health system within the local patch. So, you know, as I mentioned earlier, we do have a number of patients who are in beds at any one point in time who could be being looked after elsewhere. So it's also making sure that people are in a bed at PCH who only they absolutely need to be in that bed and they couldn't be looked after elsewhere. So it is about looking at what the facility needs to be in the future in terms of the space, but also how the hospital works as part of that wider system of care across the local community, and working also with the community hospital facility we have down at YCC, Ysbyty Cwmcynnon, where a number of the patients from PCH move to once they're ready to be discharged from the acute setting.
Yeah, thank you. And the last question I have, as we were aware, with the increased amount of patients going to Prince Charles, is there any plans to improve the car parking facility for patients there, as it does have a knock-on effect into the Gurnus and Galanacher area even, with people attending the hospital? I've known some people having to park their cars in nearby estates and walk at least 10 minutes just to get to their appointment. I've noticed that there's ongoing work on the car park now, but it doesn't seem to be on a multi-level basis, which would count for a number of cars parking there.
Yeah, so yes, you're absolutely right. The parking has been a challenge over recent months, particularly with the work that's going on the site and the need for us to ring fence off some of the areas for the works to take place. Obviously, I mentioned earlier about our ambitions around sustainability. We're trying wherever possible to look at how we deliver services, and much of the COVID period has shown us that actually in some of our services previously we would have required people to drive and park at PCH can now be delivered virtually. So we're seeing many of our outpatient consultations, for example, being done over video calls now rather than people needing to travel. So part of the strategy for parking is to try and stop people coming to the hospital if they don't need to come into hospital for something. But clearly, if they do need to come in, we need to make sure that the parking is available for them. So a key part of the work that we're doing on the PCH redevelopment programme is also looking at the car parking and seeing what we can do to improve the car parking capacity. But as I said, it is going to be a bit of a challenge over the next few months or years whilst we go through the programme of work, because it does mean we have to take certain bits of that the estate out of action for a period of time to enable that to happen. So but it is something we're very acutely aware of, and particularly the impact that has on the neighbouring roads and residential streets. So it is something we're very actively working on, and making sure that we're involving local residents is, as part of those conversations, will be really important as well.
Thank you very much.
Okay, thank you, Councillor Isaac. Time is pressing, so we'll take one last question from Councillor Geraint Thomas, and then we'll need to move on. Councillor Thomas.
Yeah, thank you, Mr. Mayor, and thank you both for coming this evening. I'm not going to dwell on the problems at Prince Charles. I think that's been dealt with a lot of questions this evening, but I think we all share that same concern as a super hospital now at the northern end of the valleys and South Powys. But my question is more on a strategic economic level. You mentioned you had 13,000 employees. Councillor Jones mentioned the new hospitals cost £120 million. I don't know what the spend is annually for the health board, but I imagine it's going to be very, very large. So my question is, what links have you had or have you got with our economic regeneration team in the council and our procurement teams to have a look at the potential job creation through our teams with yourselves and the procurement as well to local businesses? So that's my question to you.
Thanks, Councillor Thomas. Just to give you an indication that the annual budget for the health board is £1.1 billion. So that's our total annual budget. So as you say, a significant amount of money that we're spending on provision of healthcare for the local community. And as you rightly say, we want to make sure that where we're spending money on supplies, on equipment, on building materials, wherever possible, we're trying to source that from local suppliers. So to give you an example, on the Prince Charles redevelopment programme, there are clauses written into the contract with the developer that they have to procure staff and workforce from a certain percentage of that workforce has to come from within the local community, and that we have to use local subcontractors where possible for certain parts of that work. So we try and build that into our contracts for big programmes of work such as that. But as part of our sustainability agenda, we're also looking at what we can be doing to procure much more local supplies. So, for example, we've got an active conversation going on at the moment about sourcing food. And where do we source our food for patient meals, our canteens? How can we make sure that as much of our food provision in our hospitals and our facilities comes from local suppliers and and this is an area, I think, as you say, that we have a real opportunity to work in a joined up way with the local authority, because colleagues in the local authorities, to be fair, I think are further forward on some of these conversations than perhaps we've been in the health board. So we'd like to be able to work with your colleagues in the council to try and tap into some of your knowledge and expertise on that, and it's an area of work that we've had conversations about in our chief exec meetings with the 3 local authority chief execs, actually, about what we can do to try and make sure that as much of our buying is done. I mean, there's some really, I could tell you some really shocking statistics about the amount of things that we still buy in from China, for example, that probably we could procure locally. I could tell you the stories about the chicken that gets supplied to our facilities that comes from the Netherlands, and ridiculous scenarios like that. So there's suffice to say there's a lot more we can be doing and to make sure that we are using our sort of buying power as a large organisation in a much more active way to support local communities.
Yeah, that's great that you put that in. And I can see Alan Owen's got his hand up there now, so I think he's going to come in as well and challenge you.
Thank you, Chair. Thank you, Councillor Thomas. No challenge. This is something, obviously, a conversation we've been having with some of you colleagues, Paul. can I suggest that myself and Ellis set up a round table discussion with yourself and some of your team, because we've got some interesting proposals that we'd like to explore, both about employment and route ways to employment, as well as joint procurement.
Yeah, no, I'd be really happy to do that, and can bring colleagues from our workforce team and our procurement team as part of those conversations.
Okay, thank you for that. I think we do need to be moving on now, but I believe that the leader of the council would like to make some remarks.
Yes, thank you, Mr. Mayor. If there are any unanswered questions, by the way, I know already speaking to Paul yesterday, he's more than happy to address any of those. So please feel free to put them in an email, and Paul will get back to you with regards to that. Mr. Mayor, I would just like to pass on my thanks really to Paul, Greg and Richard, for the presentation this evening. And whilst there's been some really good questioning and some, really pertinent points about the improvement plans, etc., and obviously the wonderful news about TNVIS, which I was lucky enough to have visited. We have to recognise as well just what the Health Board has done with regards to COVID testing and vaccinations as well. So it's finding that balance, isn't it? It's still looking at, areas that need further work, further development and investigation, etc., which Paul and Greg and Rich have outlined tonight in the presentation as far as the way forward. But I also have to recognise all of the hard work of all of our health colleagues in relation to, as I said, testing and vaccination as well. So, Paul, you did mention that, our regular meetings with the Chief Exec. Thank you for those as well. They were obviously weekly. We're now having them fortnightly, but they are well received, keeping us abreast of all the information that we need as a local authority. And I note what Alan just said as well is, taking those relationships forward really and growing on those relationships between the Health Board and us as a local authority. So many, many thanks from us all. Apologies, we have to keep to a tight schedule this evening. I'm sure our colleagues could have more questions all evening, but really just want to thank you all, and let's continue these conversations. Thanks.
Okay, thank you, Leader. I see that 2 councillors are indicating they want to speak. So if they've got some comments, if they could keep them very brief, because we do need to move on. Councillor O'Neill.
Yeah, it's not a personal comment to me. I think it's very important. It'd be remiss of me not to relate to Paul. To say he came in the midst of a storm is putting it mildly. I was there in 2020 with him. I'm delighted you're still here, Paul. I mean, also to Greg and also Kalechi, who's not here. As I say, I was fortunate to be with you at those times. The negativity of the maternity stuff and the positivity of TNVIS. I'm delighted you've come through it all safe and well. Yeah, because unless you've been in a business where you deal with critical demand and you deal with people's lives all the time, people don't understand really what it's all about. It's one thing on paper. It's one thing to deal with it in real life. And to be situated in the midst of Prince Charles, like I have been in another life, is a very difficult place to be. So I'm delighted that things are moving forward. I do concur with my colleagues, the questions put to you. I do believe that forum that Lisa refers to should be widened out to deal with all those issues, and I'm delighted that Alan Owen has jumped in there to sort of get involved in that. I just wanted to say, Diane, thank you very much for what you're doing. Keep on doing what you're doing. And these meetings are very, very important. But who would have thought those dark days of 2020 that we would still be here now and hopefully coming out the other end of COVID. So I just want to make that personal point. I'm glad to see you well, and I'm glad to see you pushing forward. Well done.
Okay, thank you, Councillor O'Neill. So we'll take one final comment from Councillor David Jones then, please.
Yeah, thank you, Mr. Mayor. And this again is on a personal note. Anecdotal evidence and reports are all well and good and generally what we rely on. But can I speak as a recent inpatient at PCH to give actual evidence of the services that are provided there? Can I say that the care I received and that of my fellow patients in the ward was exemplary, with everyone from consultants to domestics carrying out their roles efficiently and effectively, especially on Ward 11. The many tests I received were carried out quickly and results were returned promptly, providing a prompt diagnosis and recovery plan. I cannot speak highly enough of the care I received there, and I'd like to thank you all very much. Thank you. I've kept it as brief as I can.
Thank you very much. That's really positive to hear.
Yeah, thank you very much, Councillor Jones. It's good to hear you received such good care while you was in the hospital, and I hope you're fully recovered now. Thank you for the presentation, guys. You're quite welcome to stay for the rest of the meeting if you want to, but I wouldn't blame you if you didn't.
Oh, well,
thank you very much for attending tonight.
Thank you.
Thank you.
Thanks, Mr. Mayor.
Okay, so we'll move on to the agenda now then. So the next item is item 4, minutes of previous meetings. That's items 4A to 4H. Would somebody like to move those, please?
Yes, Mr. Mayor, I'd like to move those.
Okay, and do we have a seconder, please?
And I'll second them, Mr. Mayor.
Okay, Councillor Julian Amos, have you got a question on the accuracy of the minutes?
Yes, Mr. Mayor, just a small thing. On page 7, perhaps I'm being a bit pedantic, but shouldn't the list there be for the amendment, not the motion? Because it says that they're voting for the motion. Shouldn't that be for the amendment?
And perhaps Caris would like to clarify that.
Or am I being pedantic? I don't know.
I think you may be being pedantic, but I can't see it, unfortunately, in the copy that I've got. So perhaps I can get back to you afterwards if we approve the minutes as they stand currently.
Okay, yeah, Carrie. It's just that you recorded the vote and it was on Andrew Barry's amendment. The other thing was, and it is a question, is did we take a second recorded vote on the main motion? I can't remember.
No, we didn't.
We did. Okay, thank you, Carrie.
Okay.
Okay, thank you. So if that's all okay with everyone, we'll take it to a vote then, please.
Thank you. So could I ask all members who wish to abstain, please show now. Oh, and can I, before we do that, I'm so sorry, Councillor Amos, are you, yes, can you put your hand down? There we go. Thank you. So can I now say all members who wish to abstain, please show now. Thank you. All members who wish to vote against, please show now. Thank you. All members who wish to vote for, please vote now. And that's carried, Mr. Mayor.
Okay, thank you very much. If we could all lower our hands then, please. There we go. Thank you very much, members. Next item, agenda item number 5, notice and motion, and I believe that's being presented by Councillor Julian Amos.
Yeah, thank you, Mr. Mayor. First of all, I think I should apologise to everyone for the quality of my handwriting. It was only when I started this meeting I discovered that the motions weren't typed up, and I thought it would be typed up, but that's my mistake. Firstly, I'd like to make it crystal clear that to everybody that this motion that I'm putting forward it's got absolutely nothing to do with the historic reasons for conflict between Israel and Palestine. If for no other reason, I'm not at all an expert on it. What the motion it does seek to do is to recognise the work of Archbishop Desmond Tutu and the thinking that was behind the rather inspired decision by the Labour-led council at the time, led by Reverend Bill Morgan in 1986, to grant Archbishop Tutu the freedom of the borough. Actually, I believe some of the councillors who took part in that decision are here tonight. I'm not sure if Councillor Rogers was Councillor Bill Smith and Councillor Harvey Jones. I might be wrong. In moving the motion, Councillor Skinner and I believe that what inspired that decision then should inspire a permanent tribute to the work of the Archbishop now that he has passed away. The raising of the flag would not indicate any support for Hamas or the Israeli army, but to raise awareness of the suffering and deaths of over 3,000 people in Gaza, in addition to apartheid in South Africa. This is what the late Archbishop cared so passionately about. By doing what I'm suggesting in the motion, hopefully, like the Archbishop, we can raise awareness of the suffering of the people of Gaza and hope that there will be some sort of ceasefire to bring peace and stability to that troubled land. We wouldn't be the first council to fly the Palestinian flag for such reasons. West Dunbartonshire, Tower Hamlets, Preston, a number of the London boroughs and Bradford do fly the flag, as do some others. I won't keep members too long, but I will end my little bit on this note. In a dinner a few years ago, our Freeman thanked the people of Wales for helping South Africans free themselves from apartheid. And this is a quote, it isn't my words. He said, "You may have forgotten that once South Africa had something called apartheid, and we got incredible support from you people here in Wales. I remember going to a lovely place called Merthyr Tydfil, who presented me with the freedom of their county. And here we are, free today. It wouldn't have happened, certainly, it wouldn't have happened as quickly as it did, had it not been for people like yourselves and the lovely people of Merthyr Tydfil who supported us." I ask you all to bear those minds in words when you think about the motion tonight. Thank you.
Thank you, Councillor Amos. And I believe Councillor Tanya Skinner is seconding the motion.
Yeah, just to say that I support my colleague wholeheartedly and congratulate him on raising awareness on such an issue that's very often overlooked. And I second the motion and reserve the right to speak.
Okay, thank you, Councillor Skinner. Are there any questions on the motion? Councillor Gareth Lewis is first, please.
Thank you, Mr. Mayor. On behalf of the Labour Group, I'd like to propose an amendment to the notice of motion.
Yes, Mr. Mayor, that's perfectly in order for for Councillor Lewis to do that.
Okay, Councillor Lewis.
Thank you, Mr. Mayor. Oppression and equality based on religion, race, beliefs, history, or simply who you are is not limited to Palestine. People across the world are subjected to harsh and authoritarian treatment where human rights are suppressed. In unity with those facing injustices and oppression, and in recognition of the work of Archbishop Mr. Desmond Tutu, the Labour Group calls on this council to raise the internationally recognised flag of Amnesty International annually on Amnesty International Day, which is the 28th of May.
Okay, thank you. And is Councillor Clive Jones seconded in that?
Yes, I'll second that, Mr. Mayor. And I've got a question as well on the motion.
Well, we won't be dealing with the motion yet because there's a seconded amendment. So can I just check with Maya, have you got the amendment written down?
Yes, Montreux, sir.
Thank you. So, Mr. Mayor, you can then take questions on the amendment before we proceed to a debate on that.
Okay, thank you. And Councillor Lisa Mitten has her hand raised.
Thank you, Mr. Mayor. Gareth, can I just check? Apologies, I was just trying to write down the wording. Can you just reiterate for me? The amendment is to have obviously Amnesty International's flag flown annually on the International Day, but just that flag, yeah? Not. Can you just reread it again? I do apologise.
That's correct. Yeah, it would simply be the flag of Amnesty International. You may know, Lisa, that it's a yellow flag symbolising a candle shrouded in barbed wire.
Yeah, no, I do agree, having been a member of Amnesty International. So just wanted clarification on that, because what I was concerned about was that we were marginalising people and we shouldn't be marginalising anybody. So thank you for that, Gareth.
No problem. Thank you, Lisa.
Okay, thank you. Are there any other questions on the amendment? No one is indicating. So are there any comments on the amendment? Councillor Geraint Thomas is first.
Yeah, thanks, Mr. Mayor. And yes, Gareth, I welcome that. I think that's a real great idea. You know, like you said, there's a lot of suffering going on in the world, and we should be supporting everybody. So yes, I really welcome it. Thank you.
Thank you, Councillor Thomas. Councillor Clive Jones.
Thank you, Mr. Mayor. Amnesty International was formed in the UK in 1961, and in fact, its headquarters is here in the UK as well. Its mission is to campaign for a world in which every person enjoys all the human rights enshrined in the Universal Declaration of Human Rights. It draws attention to human rights abuses anywhere in the world and campaigns for compliance with international laws and standards. It works to mobilize public opinion to generate pressure on governments where abuse takes place. And we all know this happens daily to millions of people throughout the world. I am more than sure that Archbishop Desmond Tutu was no doubt a supporter of Amnesty International. Thank you.
Thank you, Councillor Jones. Councillor Tony Rogers, please.
Thank you, Mr. Mayor. That I heard the amendment. I think that Archbishop Desmond Tutu, or Arch as he was known, I think he'd be satisfied with that, actually, because I'm not sure about Bill and Harvey, but I spent quite a lot of time with the Desmond Tutu when he came over. In fact, to be another one, my wife and my son had communion off him in Bill's church in Medara, and Councillor Bill Morgan brought him here. Yes, I did. I spent quite a lot of time with the man, and he was obviously a fantastic person. And Merthyr went down well with him, but I think this would cover it, because that's the type of man he wanted. And I think Amnesty International would suit Archbishop Desmond Tutu. It suits me. And then you cover it everywhere, because if you start on one, you can put 100 flags out there. That's the difficulty you've got. I mean, there's so many countries being oppressed. Wales, Scotland, Ireland. We've all been had the boot into us. Oh, you haven't got to look further in our countries. So what I say is Amnesty International will do me. I'll support that, but not to one flag. And I think the late Archbishop Tutu as a great man, I think he'd be very satisfied with that. Thank you.
Okay, thank you, Councillor Rogers. Councillor Amos, as you proposed the original notice of motion, did you want to comment now, or do you want to listen to the other comments and then come back at the end?
No, just Mr. Mayor, in terms of comments on the amendment, Councillor Amos can speak now. It would only be the proposer of the amendment, Councillor Gareth Lewis, who would close the debate on the amendment. So it's OK for Councillor Amos to speak now.
I just wondered if you wanted to hear the other comments, but if you'd like to speak now, that's absolutely fine.
Thank you, Mr. Mayor. Obviously, I'm a bit disappointed that people feel the way they do, but I can understand their thinking and their rationale. It occurs to me that he was the freeman of our county borough, and I can understand, as I say, the reluctance of some members to single out one particular cause, particularly perhaps one that's controversial. But I'm disappointed that I was half expecting Councillor Lewis to say, well, instead to recognise the Archbishop's contribution, that we put some sort of, like we have done with other people, some sort of permanent plaque on the wall of the Civic Centre or the library, or, you know, we have Dick Penderyn on the wall of the library. I don't want to, time is going on. I don't want to drag the meeting on, but I think that would have been more appropriate than flying a flag of a generalised nature once a year. But as I say, I can understand the comments that have been made, and I don't decry them in any way.
Okay, thank you. Councillor Chris Davis.
Yeah, thank you, Mr. Mayor. I obviously wanted to commend Councillor Amos and Councillor Skinner for being brave and bringing forward, as Councillor Amos has himself said, a controversial motion to honour the work of Archbishop Tutu in terms of, all he's done for human rights, equality and diversity across South Africa and the world, but also to say, congratulations and well done to the Labour group for bringing forward an amendment to this motion that allows this council to be able to recognise the suffering and the human rights crimes and atrocities that are committed to people right across the world. And this seems to me like a very more fitting way to recognise all of the suffering and hatred and human rights, issues that people of, all protected characteristics, face in this county borough and across the world. And I'm very pleased, and like Councillor Rogers, I'm sure that Archbishop Tutu would be very proud of the debate and discussion that this council is having this evening on this very important and significant issue. Thank you, Mr. Mayor.
Thank you, Councillor Davis. Councillor Darren Roberts, please.
Yeah, thank you, Mr. Mayor, and I'd like to echo Councillor Davis's comments on congratulating Julian and Tanya for bringing this motion to council. I also agree that it's a fitting tribute to the late Freeman Archbishop Desmond Tutu. However, we are not talking about one nation. We are talking about multiple nations, and I think the sensible approach by the Labour group here to move an amendment, I think, will be widely appreciated by many. And I'd like to thank Gareth for the way that he eloquently delivered the motion as well. Thank you, Mr. Mayor.
Thank you, Councillor Roberts. If no one else would like to speak, I will ask Councillor Gareth Lewis to close the debate then, please.
Thank you, Mr. Mayor. Yeah, and thank you to Julian and Tanya for bringing this important notice of motion to full council. I feel the amendment was needed because Archbishop Desmond Tutu didn't just champion the rights of apartheid in South Africa, or indeed oppression or inequality in Palestine. He championed human rights across the whole of the world, and he did that in a principled and forceful nature. And we should be absolutely honoured to have such a distinguished gentleman as the Freeman of our county borough. Just following on from Julian's point in respect of a permanent commemoration for Archbishop Tutu, I think that's entirely appropriate. And I think that's something that the local authority can certainly look to in future. However, this particular notice of motion referred to the raising of a flag and did not stipulate a permanent memorial as yet.
Okay, thank you, Councillor Lewis. So in that case, I'll hand you over to Caris to take a vote on the amendment.
Can I say, Caris, I'm
No.
perfectly prepared to accept Councillor Lewis's amendment.
I'm glad you agree it, Councillor Amos, but we are going to need to be disciplined, and you know that the debate had been closed. So, right, so members, you now need to vote then on that amendment, and that is that we raise the internationally recognised flag of Amnesty International annually on the relevant day. And so can I take you through that in the usual order, and can I ask all those who wish to abstain, can you please show now? Thank you. All of those who wish to vote against, can you please show now? Thank you. And can all of those voting in favour please show now? And so, Mr. Mayor, the amendment is passed and the original motion falls away.
Okay, thank you very much. So if you could all lower our hands, please. Thank you all very much. So we move on to agenda item number 6, which is the revenue budgets 2022-23, the medium-term financial plan update. And that's Councillor Chris Davis taking this report, please.
Yeah, thank you, Mr. Mayor. This will and should be a report that's very familiar to councillors this evening. Obviously, our officers have taken us through a councillor workshop, and only last week we had a joint governance and audit and scrutiny committee. So this is a report that members have considered on a number of occasions, but obviously it's been to Cabinet this afternoon and was endorsed, and obviously the recommendations to bring this and the recommendations contained at section 2 to members this evening. So section 1 of the report provides members with a summary. Section 3 provides a background and an introduction in terms of the Council's current assumptions in respect of the medium-term financial plan. Mr. Mayor, Section 4 outlines the journey of the UK Government and the Welsh Government in terms of a narrative of the provisional settlement for 22-23. I wanted to spend a little bit of time focusing on Section 5, which is the financial plan, the budget for this council. So at 4.1, we note that journey of us getting to the local government settlement, which was announced very late on the 21st of December, which is not unusual, but it didn't leave us with a huge amount of time in terms of planning to get it to members' workshops, to scrutiny and governance and audit, and here to council this evening. Members will note at 5.1 then of the indicative budget deficit reported at £5.264 million for 22-23, and a cumulative over the term of the MTFP of £11.62 million. These are based obviously on the assumptions contained in the Council's current MTFP, and Table 1 does outline that position currently up to 25-26. Mr. Mayor, obviously we note that this council did receive a 9% settlement this year, but this is against the backdrop at 5.5 of already the additional financial and unavoidable demands that were in the council's medium-term financial plan. Obviously, 5.9 of the report outlines the efficiency proposals. Members will note that the 9% settlement included restricted budget headings which were caveats within the budget, and those included at 5.11 and 5.12 the pay award projections, at 5.13 the real living wage for care workers. Also, we need to note at 5.16 the consumer price index rate of inflation, which was announced on the 19th of January, the impacts of the budget on the increase for next financial year onwards of national insurance contributions, which has left this council really not with considerable amounts of money left in our disposal, at the end of the year, in order for us to be able to support and development, Mr. Mayor. It looked like a really handsome settlement, but in reality, it's not really been a significant windfall, sadly, on this occasion for the council. So, Mr. Mayor, I'll take members to the recommendations contained at section 2 of the report, and they are at 2.1 the implications of the provisional local government settlement for 2022-23 outlined in section 5 and appendix 1 and 2 be noted and accepted. At 2.2 that the net additional demands which were not already approved outlined in section 5 and appendix 3 be approved. At 2.3, the efficiencies proposals which were not already approved outline in section 5 and appendix 4 also be approved. At 2.4, that the pay award projection outlined in section 5 and again appendix 5 be approved. And at 2.5, the real living wage for care workers and the impact outlined in section 6 be approved. And subject to moving, I'm just going to ask the Chief Finance Officer if he wants to come in and add any further narrative to what I've said.
Okay, thank you, Chris. Yes, if I could refer members to paragraph 5.7 of this report, which is on page 38. And it's in respect of the hardship fund, and we've actually booked in advance for just some of the homelessness costs that we just will be incurring in 22-23 from the hardship fund in 21-22, and that was as per the Welsh Government guidance. We've had some further discussions, and now it is the case that we won't get all of the costs for 22-23. They just won't all be covered by the by just this hardship fund grant. So that has been confirmed. So we're still hoping that we will get grant for most of that cost. But as it currently stands, I would estimate that we potentially are going to lose grant income of about £600,000. So that means that we'll have to find another option and to finance about £600,000 of those homelessness costs. So what I'm advocating is that we use or utilise some of the surplus outturn that we're estimating for this current year, which should be in excess of about £800,000, and in fact it'll be more than that. So I'm just advocating that we use about £600,000 of that money, and to then replace that loss of grant income. So that's something that we were informed of late last week, and we've had a discussion with just officials, and that was held yesterday, in fact. So that is where we currently are with this hardship fund money.
So, Steve, obviously I've moved recommendations 2.1 to 2.5. Do you want to add additional recommendation in you, or do you want to bring that back to a further report to Council? I know you're sharing this information with members. Do you want to add an additional recommendation you now, or bring this back subject to further report?
I think it's the case, but because we're still waiting and to actually hear how much grant we are going to receive and to support us with those homelessness costs, I would say at this stage that it's best if we come back to the next council. But again, I should say then that that doesn't have an impact on this report and the recommendations of this report.
Okay, thank you, Steve. So, subject to questions and comments, then, Mr. Mayor, I move those recommendations. Thank you very much, Steve. Thank you, Mr. Mayor.
Thank you, Councillor Davies. Is there a seconder, please?
Yeah, I'm happy to second that, Mr. Mayor, and obviously just being mindful of the updated information that Steve has given us, but those recommendations can still, in my eyes, be moved and seconded. Thank you, Mr. Mayor.
Thank you. And Councillor Clive Jones has some questions.
Yes, thank you, Mr. Mayor. In relation to the news that Steve Jones has given now, what was the reason why they reduced that figure of £2,064,000? You know, having, by the sound of it, clearly indicated that they were prepared to allow the pre-booking of that amount. What were the reasons they've given to reduce that figure, frankly, quite substantially? This is a huge issue, which will obviously be ongoing in future years.
Yeah, what was basically said that they just weren't expecting under any authority to just advance book for the whole year. So they were a little bit surprised as to the value of our hardship fund claim. But as I said earlier, really, we had indications that we could advance book for the whole year, and we didn't have any restrictions as to the timeline or to the value. But I don't think that the officials were expecting, I think, authorities to book for the whole year And I think it was the value that that I think shocked them, I believe, so that they were very, very surprised at the value, I think, which just indicates that we do have an issue within this authority with that homelessness cost. So I think it was a bit of a surprise for the Welsh Government that that was the case. But as I said, we had a discussion yesterday, and we still feel that we should be able to get most of that money back through grant, but there is that gap which we now have to replace.
Thank you for that. Mr. Mayor, so I presume that the other 21 authorities have also had their monies for this homelessness issue cut back as well. Surely we haven't been singled out as one particular authority.
It's, as far as I understand, it's only ourselves at this point in time who've actually claimed for the whole year. It's obviously the case that there are a number of months left within this year where just other authorities may claim. But as it currently stands, up to this point in time, it's only us who basically claimed the cost down for the whole year, is because we just have advance booked for next financial year, or for just for the whole year.
One last point and question, Mr. Mayor, do the Welsh civil servants understand that we have a serious problem with homelessness here in Merthyr Tydfil?
I think they do. I think they've got that. I think we had a conversation yesterday with them. And as I said, really, they were surprised, I think, with the numbers that we had. And we did stress that we don't have many other options really within this area than to just advance book and to use the hotels and new establishments that we have in this borough. So I think the message has got understood, but I think they were a bit shocked initially with the actual numbers that we had going forward into next financial year.
Okay, did Alan Owen want to come in at this point?
Yeah, thank you, Mr. Mayor. There's regular dialogue throughout the housing network with Welsh Government representatives, obviously about the situation and the fluid nature of homelessness. What you've got to understand with government, that obviously different departments deal with different aspects of the issue, and this is the hardship fund and the financial implications. We'll be endeavouring to discuss this both with the Welsh Government officials and obviously political representation about how departments join up their thinking, because we put a request in relation to actual costs, not estimated costs, but that is something we will pursue. So it is a very fluid situation at the moment.
Okay, thank you for clarifying that. Councillor Jones, did you have any other further questions?
No, thank you, Mr. Mayor. Thanks.
Okay, thank you, Councillor Jones. Councillor Geraint Thomas, then, please.
Yeah, Councillor Jones asked very pertinent questions there, and he was spot on with them. My question is to Chris and Steve, really. You know, when we last year we were third best in the whole of Wales for a settlement, and this year we are 16th. Knowing that the issues that we have with homelessness and prison leavers in Merthyr and the poverty agenda, do you feel that we deserve to be 16th on the list, or should we be higher up the table?
Steve, I'll let you pick that one up.
It's certainly the case that from the 16th, where we've been reducing, or we have reduced, in fact, from being the third best last year to now the 16th best. And that's all because of the magnitude of the actual settlement increase for next year. Because the settlement is made up of just a formula. Part of that formula is the revenue support grant. And then the second part of the formula is a notional council tax increase. So what's happened in years gone by is that the notional council tax increase has increased at a greater rate than the settlement figure because the settlements have been lower. So that's meant then that we basically gained, because we are one of the authorities with a lower tax base, we then gained along with Blaen y Gwent and around the Cynon Taf because we have a lower council tax base. What's happened this year now, because the settlement has increased at quite a significant rate, what we found is those areas now where the higher tax base have now gained because they've now got more grant and they've got a smaller share of the council tax pot. So that's how the formula works. It's not exactly an easy thing and to get your head around. It is a complicated formula, but that is the just actual reason as to why we now find ourselves as the 16th best settlement in Wales. It's all to do with it's just the mechanism around this settlement formula.
And I think, Councillor Thomas, is a very, very good question. It's an pertinent one that all of us across this council chamber really need to be asking, because it looked like we were all jumping up and down on the 21st of December to think we were going to have a 9% settlement. And when Steve and his team started to pick it apart, and you look at the pay award, you look at the national insurance levy contributions, you look at the levy for care workers, and you break all of that down bit by bit, we haven't had a particularly great settlement for the reasons that Steve has said. And it is a very much, and I'll say this, not being political about it, saying it for what it is, it's very, very much been a smokes and mirrors budget. And I think some of the richer have got richer, although they've had to use that to offset the costs that were in the RSG around pay award, national insurance contributions, and obviously levies for care workers. But some of the richer have got richer. We've stayed the same, got poorer. And I think we've absolutely got to, make that case, all 32 of us here, as we move into local government elections over the couple of months, make that case very loud and clear to Welsh Government, really, that communities like Merthyr Tydfil need more if we're going to prosper, if we're going to develop, we're going to grow, and we're going to keep people out of poverty. Thank you, Mr. Mayor.
Thank you. So Councillor Lisa Mitten, please.
Thank you, Mr. Mayor. It was just in response to something Clive had said as part of his question. I just wanted to give him some reassurance that as leader of this council prior to Christmas, I called on the minister to actually address all leaders, all 22 leaders. And on the 13th of January, we attended as leaders the Housing Cabinet meeting, and I expressed certainly our concerns on behalf of Merthyr Tydfil then, not only in relation to the funding, hardship fund, etc., but also in relation to, if you like, the monster that we've now created in trying to address some of these needs and some of those really serious, complex needs as well. So just to give that extra reassurance, Clive, we are certainly being vocal about it, and I continue to do so along with my cabinet member. Thank you.
Okay, thank you for clarifying that. Councillor Kevin O'Neill has a question.
Yeah. Sorry, is it questions or observations?
No, we're still on questions at the moment.
Oh, I do apologise. I've got a question.
Come back in later. Yeah.
Okay. Yeah. Well, if no one else has any questions, they don't. So you could make your comment now, Councillor O'Neill.
Okay, thank you, Mr. Mayor. For me, and I'm sure most people, the budget was clear. If you're 16th or 15th, us and Blaen y Gwent was solely left behind. I certainly was aware of all those debits that were coming out of there. So I knew that 9 million wasn't really 9 million, it was half. I'm sure many of our colleagues did. So I'm quite surprised at some of the comments there if it came as a surprise. And it's not the failing of officers, this is failing of Welsh Government. I don't know why officers are getting blamed for it. Julie James came in with a policy on housing that in its element was naive to house every person who presents, particularly in many of our areas in the valleys where we don't have the infrastructure, we don't have the resources, and we don't have the finance. It was that's why so many people are now in the Castle Hotel, in a place where we haven't got any accommodation for visitors and tourism. Our one major hotel, the town centre, is full of homeless because the infrastructure, and this is not saying that we shouldn't support those who are homeless, far from it. I just think it was naive in its extreme the good intentions, but the application and presentation of that. And I'm pleased to hear that Lisa has raised that, because I raised it many times myself. And being a town ward councillor, I live with it every single day and see the problems. And I know there are steps being taken to remedy these problems, and Alan and his team are working very, very hard to do so. But I do think that the recognition of the position we're in is very slow in coming. How many times do we have to raise this issue? And I really would like something seen to be supporting Alan and his team as they try to restructure the infrastructure of all the service industries that lie around our high street and bring in all the problems for our high street, and also work in direct conflict to our goal of making our high street a place where people feel welcome and a place where businesses can thrive. Thank you, Mr. Mayor.
Thank you, Councillor O'Neill. Are there any further comments? Yes, Councillor Clive Jones.
Thank you, Mr. Mayor. Yes, I think that in view of the questions and the comments just made by Councillor O'Neill and the further discussions that are clearly ongoing and taking place with the Welsh Government, I take the point as well from Alan Owen that some of these departments of the Welsh Government appear to be working in their own little fields and silos. I think we need to have a detailed report as to where we are with this once those discussions have been completed. Thank you.
Okay, thank you, Councillor Jones. Councillor Chris Davis has got his hand raised, but has anybody else got any comments to make before he finishes the debate? No one else is indicating, so I believe Councillor O'Neill's is a legacy hand. So, Councillor Chris Davis, if you could close the debate, please.
Yeah, thank you, Mr. Mayor. Can I thank all members for their contributions? And you know, as the Cabinet and officers, we are as frustrated around the significant challenge that we have around you know, the challenges of the homelessness. You know, we've got a really ambitious town centre master plan for regeneration of you know, areas like St Penderyn Square, Pomolais and other parts of the county borough, and these are being impacted by the issue we have around the town centre. Cabinet did consider a report this afternoon in respect of Marsh House, so officers are working extremely hard in respect of housing, and I know the leader and the Cabinet member for Public Protection, Housing and Regeneration will continue with officers to make representations to officials and to ministers at Welsh Government on the crisis which is our homelessness. But we have a statutory duty, and obviously we have to properly make sure we've got the budget in place accordingly to support that. So, Mr. Mayor, just wanted to finally really put on record my thanks, Cabinet's thanks to Steve and his team. This has absolutely been a moving feast. It's been like nailing jelly to a wall, you know, in terms of trying to pin down the figures. We still don't have them, and probably we'll go into budget setting and council tax setting and we won't have all of the figures, and we'll have to deal with that at next year's outturn position. But you know, I'm really grateful to Steve and his team and officers right across the organisation who've worked really hard on this paper. Steve, diolch i chi, eich team am eich gwaith galed for your really hard work on this. Thank you, Mr. Mayor.
Thank you, Councillor Davis. So I'll hand you over to Caris to conduct the vote, please.
Thank you, Mr. Mayor. So can I ask all those members who wish to abstain, can you please vote now? Thank you. All those members who wish to vote against, please vote now. Thank you. All those members who wish to vote in favour, please vote now. I think I've just got 2 more votes to be cast. Thank you. That's carried, Mr. Mayor.
Okay, thank you. So if you could lower our hands, please. Thank you very much. So we can now move on to agenda item number 7, empty property strategy 2022 to 2026. And that's Councillor Geraint Thomas taking this report.
Thank you, Mr. Mayor. So following that depressing last report, some better news really for the local authority. This is a summary of the report. Our empty property strategy for 22-26 reaffirms the Council's continued commitment to deal with empty properties. It outlines the approach we will take by providing a clear direction for addressing empty homes, which blight our communities and adversely affect our neighbourhoods. Since the last strategy was published back in 2007, the number of empty properties brought back into use has increased year on year, with 39 properties, 7.09% of the long-term empty housing stock being returned to use in the financial year 2019-2020. The homes that have been brought back into use have helped to reinvigorate our communities and provide additional housing to our residents. Homes may become empty for short periods of time, whilst they're renovated or improved by the letting or sale, and generally these properties do not give rise to problems. However, homes that have been empty for more than 6 months are deemed to be long-term empty homes, and not only a waste of valuable resources, but can also be a source of serious antisocial behaviour, nuisance to neighbouring properties, and in some cases, blight an area. For this reason, they're the primary focus of our strategy. There are currently 568 long-term empty homes across the county borough. Our aim over the next 5 years is to bring a further 200 empty homes back into use. To achieve this, we will build on the progress already made and continue to work in partnership with empty homeowners and our partners. An integral part of the strategy is our action plan. The plan identifies new actions to be delivered in the first 2 years of this strategy, after which a further action plan will develop to ensure the target is achieved over the remaining lifetime of the strategy. Following on from that MTFP report and the number of people that are homeless in Merthyr Tydfil, the sooner we can bring these properties back into use, the better. There are a lot of grants out there that we can use, and new grants coming forward, and it's something I think that we should target in the next, whoever is in the next administration, so we should really back it. So if I go to the recommendations in 2.1, Mr. Mayor, the empty property strategy for 2022-2026 be approved. I so move.
Thank you, Councillor Thomas. Councillor Mitten, I believe you're seconding this motion.
Yes, thank you, Mr. Mayor. Seconding the motion and happy to do so. Thank you.
Okay, thank you. And I see we already have a number of questions on this. And first one is from Councillor David Chaplin.
Yeah, thank you, Mr. Mayor. On page 57, it says there are several ways in which we can bring empty homes back. And number 4 says enforcement action. How much enforcement action has actually taken place in the last 5 years?
If I could bring Melissa into that, I think she's on the call.
Yeah, thank you. When we talk about enforcement action, with regards to empty properties, we take quite extensive enforcement action to deal with the immediate public health risks. We use different legislations on Prevention Damage by Pests Act, Housing Act and things. They are the ones that are sort of precursors to us taking formal enforcement action to actually bring that property back into use, which has included enforced sales and compulsory purchase orders. So as it currently stands, we've only ever done one enforced sale procedure because the procedure is so onerous. It took us about sort of 18 months to go through, and compulsory purchase orders can be even further. So we go through all the other stages before we get to that final type of enforcement action.
Do we have? Does that mean do we have sufficient resources to do it? Is that a barrier to us not having the resources?
No, not necessarily. What happens is we start the negotiations, we give people grant assistance, we give people loan assistance, then we give them sort of advice on VAT reliefs and things. We go through the whole process, and a lot of those properties will come back into use before we need to get to enforced sale or compulsory purchase. If we get to enforced sale or compulsory purchase, our negotiations have failed. So the fact that we've got a limited number of them actually indicates that we've done a better job in other respects. But obviously, what we've identified now as part of the strategy is we do have a number of empty properties where we don't have the owners have passed away, there's no forwarding person, and there is nothing going to happen with those properties unless we take enforced sale against them, which is the one that we did. There was no owners, everybody passed away, there was nothing. So we took ownership of that then, and we forced the sale of it. So that's, like I say, that it's only really in those extreme circumstances we need to go to that.
Thank you. I have one more question. Obviously, we changed that on empty houses. We now charge a council tax after so long. Have we got houses that have been empty for more than 5 years that we charge council tax, and these people just don't pay the council tax? So that there is no, the point of charging it is all great if the people are prepared to pay it. Do we know if there's any long-term houses that they just don't bother to pay the council tax?
Sorry, I wouldn't know. That would be a council tax question. I don't know if there's anybody here that could answer it.
If I can jump in there, not from a council tax perspective, but a lot of the long-term empties, Councillor Chapman, they are very complex, and there's complex reasons why they're still empty. So irrespective of that charge, they'll still be racking up against the council tax debt. I suppose what Melissa is trying to outline as well is the amount of work that happens on a daily, weekly, monthly basis actually prevents the figure rising from what you see now. It might seem a large figure, but the reasons behind some of these empties are very complex. Before Councillor Jones mentions the property on Brecon Road, then you can actually understand how long-term and complex it is. But I think Steve Jones wants to come in on the council tax.
Yes, it's only really to mention on the council tax information. I don't have that at this point in time, but it's something we can just find, which we can just establish for you and just send round to you.
If they don't pay the council tax, does that entitle us to put a lien on the property?
Again, I'd have to see with the council tax experts, I believe, and I'm not quite certain. So I'll have to get back to you on that one as well.
Okay. Thank you very much. That's my questions.
Thank you, Councillor Chaplin. Councillor David Hughes is next, please.
Thank you, Chair. The question I would like to ask, and maybe it's unfair to ask Melissa, I know she hasn't been there long, but do you think we need more resources? I know Councillor Chaplin mentioned it in his question. Do you think we need more resource in this area to work on these empty homes, especially when we got such a problem with the homelessness now?
Can I ask, is it okay if I answer that, Melissa? We have actually put more resources into environmental health through Capacity Exercise 1 and Capacity Exercise 2. Obviously, Melissa is now a principal officer within environmental health. So we're in the process of recruiting to Melissa's post. Melissa is the specialist in housing, which from environmental health perspective, which includes obviously empties. So we have doubled that resource, Councillor. If you can see in the body of the report as well, then we make reference to the fact that we've got additional Welsh Government resources now that we can tap in relation to long-term empties and compulsory purchase orders. So it's probably the most resources that we've had. And I suppose it's joining up our resources as well. We're currently working with housing, with our statutory housing function, which Melissa is very much tapped into, to actually work with our registered social landlords to see if there's some way we can combine the two streams of funding from the social housing grant and actually bringing these properties back into play.
Thank you, Al.
Okay, thank you, Councillor Hughes. Councillor Declan Salmon is next, please.
Thank you, Mr. Mayor. Another question for Melissa.
Melissa, we've currently got 3 properties in Dowlas and Pant that are empty and causing issues to local residents that have been brought to my attention, and I know you're aware of them. I just wonder, would you have, between the time a referral is made by a councillor or you've been made aware of a property, do you have an estimate on the timeline that it would take for a property to be brought back into use using your enforcement?
Well, there isn't like exactly a timeline. When we have complaints about empty properties, we address the most immediate public health concerns to start with, and whether we can take further action depends on the result of them. So to do, for example, an enforced sale procedure, we need to have a charge on the property and then we enforce the charge. That's how the process works. So if we are unable to get a charge on the property above a certain value, or that the owner of the property pays that, then that stops that process. So it's just trying to work with the owner then for negotiations. The only other option we have then is the compulsory purchase order route, which we haven't needed to go down as yet. And enforced sale is a far, less risk to the local authority, and that's the one that we sort of address. But all the public health concerns immediately are addressed by, myself or somebody within the team. And then the ones that are the most problematic, they're the ones that we look to take forward. Like I said, the one that we brought back into use was in the Dowlas area. There weren't any owners, and without our enforcement action, that one would have remained empty forever, really. So they are the ones that we want to target initially, where we know that they've been empty for in excess of 20 years and there are no owners, or the owners is completely unwilling to enter into any negotiations with us, and they're the ones that we want to tackle in the first instance.
Lovely, thank you, Melissa. I think that property was on Mount Pleasant Street, if I'm correct. The other question I had, and I think you've touched on it, are there any foreseeable difficulties with getting a compulsory purchase order? I think you've mentioned in there that if the charge is not above a certain amount, it has to be above a certain amount?
So with regards to the compulsory purchase procedure is not based on charges, it's the enforced sale procedure. So a couple of years ago I put the enforced sale procedure up, we gained approval on, and we just set the amount at £500. So anything over £500 we can actually enforce the sale on. But like I said, to have that, we have to take action under one of the prescribed pieces of legislation, like the Prevention of Damage by Pests Act, the Housing Act, the Building Act. All those will go as a first charge on the property and we can take it forward. Other ones that sort of, if we just board in property stuff, we can't use that as a final charge to take forward. So we are restricted on some of the pieces of legislation that we can use. If those negotiations fail, or that we can't take the enforced sale procedure, the only option that we have to bring that property back into use is compulsory purchase, which is not something that we have. I haven't written a procedure on that yet to take that forward, because with compulsory purchase orders, they generally take in excess of 18 months to 2 years, and they often end up going to a public inquiry, for which there is an expense to the local authority, which we're unable to claim back through the cost of the process. So there is a financial risk to the local authority there. But like as Alan mentioned, this funding that we've are able to access now through Welsh Government, that's what that has been set up for, so that if we do need to go down that route, then it mitigates the risks to the local authority.
Lovely. Melissa, thank you very much. Thank you for the report, and I hope it gets passed tonight. Thank you.
Thank you.
Okay.
Thanks.
Thank you, Councillor Salmon.
If
Councillor
I
Clive
can
Jones.
just reinforce, oh, sorry. If I
Sorry.
can, if
that
just
Alan? Yeah.
reinforce the fact that this is a very, very legalistic field that that environmental health are dealing with, and I think the monitoring officer can confirm the legal minefield in relation to compulsory purchase and the actual time that it takes.
Yes, Mr. Mayor, I don't want to take up everybody's time. I think Melissa has been doing a sterling job trying to answer some of this, but the answer to a lot of the questions is that they are case specific. I understand the question about can we have a sort of a generalised idea how long it takes, but in fact you can't. And certainly if you get into compulsory purchase, if it works, it takes a long, long time. If it goes wrong, it's enormously costly. So the whole idea of having a strategy that enables you to do things without getting into that process has got to be better for the local authority.
Okay, thank you for clarifying that for members. Councillor Clive Jones, then, please.
Yeah, thank you, Mr. Mayor. It's been touched upon by Councillor Salmon and Carys Kenny. Under 4.3, It says there there's 568 long-term vacant properties, and 58 of them have been empty for 10 years or more. Surely, if a property has been vacant, particularly in excess of 10 years, I got 2 of those in the ward, do you work on a priority list for those that have been empty the longest?
Yeah, that's what we're looking to do now with the strategies, to target the most problematic ones. I've written a risk-based approach, which is attached in the strategy, and it takes all these considerations into account. Like, I've got one empty property which has been empty for probably in excess of 25 years, with no issues to the surrounding area. There's no public health risks. It's quite well kept, but then you've got another property there where may have only been empty for 5 years, and all the windows are smashed through, and that's a massive visual detriment to the amenity. So we're going to take the idea of the strategy to take all the different factors into account. Another one we've added in recently is the homelessness issue within that area, and to gain a score then at the end, and that's how we're looking to prioritise the ones that we take forward for action.
Okay, I've got a second question. It's on page 59. And to be fair to Melissa, perhaps, I don't know, Steve Jones might be able to answer this, but it's under the financial implications 7.1, and it refers to the strategies and an action plan being approved by the Welsh Government as part of the Transforming Towns Empty Property Enforcement Programme. As a result of this, Merthyr Tydfil County Borough Council is now eligible to access part of the £15.2 million fund to tackle the individual properties highlighted in our action plan. How much of that £15.2 million are we going to get from the Welsh Government?
Yeah, if I can answer that rather than Steve. That's totally dependent on the actions required within our action plan, Councillor Jones. It's not an indicative allocation. It'll depend on the actions we'll need to take around the enforcement.
So the figure, depending on the action plan and what you've got in there, the figure could be a fair sum of money. Am I wrong or right?
That's not determined at this time, so I couldn't give you an answer.
Right. Okay, thanks.
Okay, thank you, Councillor Jones. Councillor Chris Davis, please.
Yeah, thank you, Mr. Mayor. Obviously, really welcome this report and the hard work put into it by officers. Melissa, you've outlined to members some of the tools in your toolbox and in your armoury, and you've talked about enforced sale. You've talked about compulsory purchase order. There is another tool. There is another option available to the local authority. And I wonder whether you could just give members some details. And obviously, that's the empty dwellings management orders that is set in Welsh Government legislation. Can we, should we, will we be looking to use those to expedite our empty homes situation and obviously release those back into the authorities' ownership or others' ownership, so they can then be used to support the, as you've heard this evening, you stayed on the call for a long time this evening, the crisis that we have with regards to homelessness in the county borough.
Yeah, the third tool is empty dwelling management orders. They're a very difficult tool to utilise. Swansea Council is one of the only local authorities that I know that have utilised it. They've had a all singing, all dancing empty property team for a number of years and have been sort of at the forefront of taking enforced sale procedures and compulsory purchase. And they wanted to trial the Edmore procedure, which they did on one occasion, and it's not something that they've revisited. It is a very difficult tool to utilise. It results in interim management orders, final management orders, taking that property over for a number of years. So it is always there if we needed it, but the preferable tools to use are the enforced sale procedure and the compulsory purchase, just purely because of the ease of them. Thanks.
Okay. Anything else, Councillor Davis?
That's it. Thank you, Mr. Mayor. Thank you, Melissa. I just wanted you to outline that additional tool although I've cumbersome and burdensome it is in our armoury, and we can use it if we need to. Thanks, Mr. Mayor.
Okay, thank you, Councillor Davies. Councillor Gareth Lewis, please.
Thank you, Mr. Mayor. I'm aware of at least 2 empty dwellings within my ward that are listed, Grade 2 listed. Given their heritage and significant historical value, is there any priority given to listed buildings in making them livable?
No, I don't think there is within this legislation, Councillor Lewis. What we do have the opportunity to do within the Transforming Towns programme is to, within certain areas, look at listed buildings to bring them back into use. But unfortunately, we still have to comply with all the can-do conditions around listing. So that doesn't ease the burden of the cost, I'm afraid.
Okay, thanks, Alan.
Okay, thank you, Councillor Lewis. Councillor David Jones, then, please.
Yeah, thank you, Mr. Mayor. A grueling night for Melissa. It follows on from Councillor Chaplin's question, really. How many of the 568 properties have been contacted, and what percentage or what number has there not been return contact, and what happens if there is no return contact?
So obviously I've been working for the local authority now for a number of years, and I've been dealing with empty properties for all that period of time. And the process that we've adopted with getting in touch with owners, started off the initial conversations and discussions, is to send them all a questionnaire every 2 years. And in that questionnaire, it gives them it highlights any financial assistance that may be available to them, any sort of advice or guidance that may be available to them, and gives them the opportunity then to re-engage with us. The questionnaire is completed if they return it back with what requirements they need to bring that property back into use, and I would contact them all individually then to tailor any sort of advice and assistance to their specific property. So sometimes they want to get into the rental market, they don't really know how to do it, so then I would give them advice on the legal requirements with regards to renting. They could sometimes qualify for VAT release if they're doing major renovations to the property, so I would advise them on that and give them the proof of the length of time the property being vacant so they can apply for that. But just recently we've had grants through the Valleys Task Force scheme, so that is the last time that we wrote to all our empty property owners to advise them all that this money was available and they could apply for it through RCT and through the Valleys Task Force. And that's had a big impact on Merthyr at the moment. We've got quite a few properties coming back into use through that. So generally, when we have something to offer them, we will write to them. And like I said, it happens every 2 years. It has done for the past 14 years that I've been here. And that's what starts our negotiation. So another letter now is due to go out this year. And they'll start negotiations then and get sort of the fresh information in from all the individual empty property owners. So, but we have quite a high, quite a reasonable success rate really for questionnaire returns, and it's where most of our negotiations start. And those are the people that want to engage with us. They want assistance, and they are, as long as you spend time giving them the assistance or the advice that they need, then we can bring those properties back into use fairly easily. They say all the enforcement action that people are referring to, that's sort of kept back for the most problematic ones. Thanks.
Yeah, thank you for that. But can you give an indicative figure of how many don't respond? And understand there could be various reasons for that if people have passed away, but I would imagine there is an element that just don't wish to make contact with us. Just an idea of the non-contact figures.
Well, when we send the questionnaires out, we generally get about a 20% return rate.
20%? Wow, that's not a very good return rate, is it?
No, but if we contact them over individual issues for their properties, if we've had any complaints, we generally have a better response then. So, but like I say, those negotiations open up with the 20% that want assistance and they want help with the things. So we've got the second route then that gets in touch with them with regards to enforcement issues that we've had complaints about within the public health complaints. So generally when we contact people, they do engage with us. Like I say, returning an empty property questionnaire, we're tackling again to the ones that want to bring those properties back into use, and we're giving them the tools they need to do that. And then the other ones, then we, when we get in touch with people that they need to clear the land because there's rats or mice on there or something, then generally that can start more negotiations then.
Okay, Alan Owen, did you want to clarify?
Yeah, if I can clarify, the exact question you've got there, Councillor Jones, is that Mel is in contact, because obviously this is over a time period. You don't just have 500 properties appearing at any one time. Mel and the Environmental Health Department is in contact with each of those properties, whether or not there's an owner or not, through complaints, etc. So to answer your question, all those properties are known to us. Either the owners we're in contact with through direct contact or through questionnaire, or through various means of trying to locate the owners.
Yeah, thank you for that. My figure is more around the ones that we don't contact rather than the ones we do.
Yeah, but my answer was that we tried to contact every single one. We can get back to you with various combinations of statistics, but obviously Mel wouldn't have that to hand now in this meeting.
Yeah, I can appreciate that. I was just looking for sort of an indicative figure, and how we then, or do we then try to make contact other than by the letters that go out, whether we try to find the owners.
Yeah, and direct contact is probably the way that Mel tries to resolve these issues, and the figures in the report, which indicate how many properties we brought back, that's testament to the fact that obviously it's direct contact is really the best route that we've got.
Yeah, appreciate that. Thank you very much. But I would appreciate the figures as well. Thank you.
Okay, thank you, Councillor Jones. Councillor Andrew Barry has a question.
Yeah, thank you, Mr. Mayor. Fascinating report. I read it with great interest. I see that Town Ward has got nearly 120 properties. As with housing across the board, we seem to have the lion's share of the problem. I've got a question on the solutions, really. There's a chart on page 21 of the report. The number of empty properties returned to use by type of local authority action. And it's pleasing to see that by far the most returned to use is by advice and guidance, which is obviously very cost effective for us. The enforcement action accounts for quite a bit, particularly in 1920. But of course, enforcement action means it's all gone a bit wrong for us. What I'm interested in is the element of financial support seems very, very low. And when it comes to empty homes loans, grants, and home improvement loans, my knowledge of that, of constituents that I've had to deal with, is that there's a very high demand for those things. And then it just seems at odds when you see then that it only accounts for 4 or 5 houses, bringing them back into use. Is it that those houses being brought don't include the home loans, grants, and home improvement loans? Is that some other sort of finance, or is it the case that we could do with more finance to support more people, so that avenue of bringing homes back into use would be more profitable? So,
do you want me to answer this, Mel? The amount of finance available for us to give out as loans, Councillor Barry, is very, very limited. It's very small, and it's quite sporadic. We're dependent on grant schemes that come out from Welsh Government or the government sources. But what it does, our previous experience does show that when there are grants available, then owners of properties who are empty would just not doing anything with them are far more likely to actually take up that grant and bring them back into productive use, whether it's for renting or for sale.
So in terms of our representation on our homeless issues to Welsh Government, this is an area we should be making representation on, because what you're indicating is it's an area where we are going to improve that housing and bring it back into use when that money is made available.
Slightly more complicated than that, because obviously the owner of the property would either have to sell that property to a registered social landlord, or agree to rent that property as a private rent for the exclusive use of free housing homeless people. So yes, but with complication.
Okay, thanks, Al.
Okay, thank you, Councillor Barry. Are there any further questions? No one is indicating, so we'll move on to comments then, please. Any comments? Councillor Clive Jones.
Thank you, Mr. Mayor. I won't keep people long because it's been a long evening. But in the figures of 4.3, where it says there 58 have been empty for 10 years or more, and all members have got problematical properties in their wards. In the case of Park Ward, we've got 2 in particular. One's been empty for at least 16 years, and the other one has been empty for at least 27 years. It is derelict. There's a metal roof on there. There are no windows there, and the appearance of it really is, frankly, appalling. It's on the main Brecon Road. I've been following this and making representations, as other members have, for years, and the problem here was that the local authority could not find the owner. That went on for years and years. Then eventually they've found the owner, and we still left with it there. So I welcome the report, and I hope to see that it comes to fruition that we have 40 properties brought into habitable use every year, amounting to 200 properties. And I sincerely hope that the property we've got on Brecon Road, which has got the appropriate name of the Haven, I can assure members it looks nothing like a haven, that is one of the priorities of a property that's been empty for so long. Residents deserve better, and people living in the area deserve better. So I hope that particular property is a priority for this council. Thank you.
Okay, thank you, Councillor Jones. Would anybody else like to speak before Councillor Geraint-Thomas closes the debate? No hands are raised, so over to you, Councillor Geraint-Thomas.
Thank you, Mr. Mayor. And can I thank Melissa for tonight, because I know she has been very well over the last few weeks, and it's been a tough fortnight, and she's answered a lot of questions. A lot of these problems that we're facing in Merthyr are national problems. You know, they're not just, local to Merthyr. And I think, Clive, you were right, and Andrew, you're right as well. I think we need more funding coming through in grants to bring these properties back into use. And prevention is always better than cure. So if we can prevent them becoming empty, long-term empty home properties in the first instance, is always best. So thank you, everyone. It's been a real great debate, and thank you, Melissa.
Okay, thank you, Councillor Thomas. So I'll hand you over to Caris for the vote then, please.
Thank you, Mr. Mayor. Can I ask all those members who wish to abstain, can you please show now? Thank you. All those members who wish to vote against the recommendations, please show now. Thank you. All those members voting in favour, please show now. Thank you, and that's carried, Mr. Mayor.
Okay, thank you very much. If we could all lower our hands, please. Okay. Don't know if there's a lag, or we're waiting for Councillor Skinner's hand to go down. Thank you. Item number 8 on the agenda, removal of means testing on small and medium disability facility grant applications. And that's back to Councillor Geraint-Thomas, please.
Thank you, Mr. Mayor. And I think another real great report coming before Council this evening, helping the most vulnerable in our society. Summary of the report is the report will provide a brief overview of the disability facility grants, the DFGs. The report also provides a detailed around the updated guidance from Welsh Government to remove means testing on the small and medium adaptations with effect from the 1st of April 2022 and the supported information around this. The report seeks the approval of members to remove the means testing with immediate effect and any contributions during the current financial year being reimbursed as directed by Welsh Government, utilising additional grant monies provided this financial year to be used for this specific purpose. So that's a very welcome summary there. If I go to recommendations, Mr. Mayor, from 2.1 to 2.2, the removal of means testing with immediate effect be approved. The return of any contribution by successful applicants made from the 1st of April 2022 be approved. I so move.
Thank you. And I understand Councillor Chris Davis is seconding this motion.
Yeah, Mr. Mayor, I'm absolutely delighted that we as an administration with our officers been able to bring forward such a fantastic report that will support so many vulnerable people with disabilities across the county borough, and I hope that all members across the chamber will support the recommendations at 2.1 and 2.2. I reserve the right to speak on this matter as well, Mr. Mayor, but I am delighted to second the recommendations.
Okay, thank you very much. And Councillor Kevin Gibbs has a question.
Sorry, Mr. Mayor, it's not a question. Just saying this meeting has gone on a little bit, and I do have to relieve my my stepdaughter's carer, so I do have to duck out of the meeting, Mr. Mayor. I do apologise. But on hindsight, on reading the report, I'm happy that this report has come forward before council, before I go, so I'm not looking at it.
Thanks very much for letting us know, Councillor Gibson. It has been a long meeting, but hopefully we're approaching an end now. But thank you very much, and obviously family comes first. So
thank you, Mr. Mayor.
Are there any questions? There are no questions. Are there any comments? Yes, Councillor Clive Jones, please.
Just quickly, I'm very pleased to see that for the removal of the means testing, I think that's overdue, and I hope to see, along with other members, more of the £850,000 that's allocated for the DGs used up. Thank you, Mr. Mayor.
Thank you, Councillor Chris Davis.
Yeah, thank you, Mr. Mayor. I do want to read, particularly to members, I know you can all read 3.2, because it's extremely significant that obviously the DFGs are a main source of help for disabled people in the great majority of households in Wales who are owner-occupiers or live in private rented accommodation, or in Merthyr Tydfil for grants over £5,000 for Merthyr Valley Homes residents. This is a main way in which they get help with the most common types of adaptations, such as stair lifts, ramps, and downstairs toilets and washing facilities. This is an absolute lifeline. Members will know this council's commitment to Homes for Life is a strategy. We have, Councillor Jones has said, struggled over a number of years to spend at any kind of speed our disabled facilities grants funding. It's lucky that it is a pot of money that we are able to roll over because it's our funds, not subject to any grant. Cabinet, during the period of this administration, have worked really closely and really hard with our officers in housing and in social services, with RCT Council and with Care and Repair, who complete these works. I want to reassure Councillor Jones and all members that this is a priority for us. We need to make sure that people have got homes that are fit for purpose, particularly disabled people. We're absolutely committed to this, and there's a real strategy that Alan and Lisa Curtis-Jones have led together with officers. One of the challenges has been, Councillor Jones, is the appointment of suitably qualified and experienced OTs. We've really battled with the health board, with neighbouring authorities, and with the private sector to get some OTs into post to really get some of these assessments rocking and rolling. I'm sure, and I know you do agree, this is absolutely a welcome addition to Merthyr Tydfil, and let's move forward now at pace to spend and award these very worthy grants to the residents of the county borough who absolutely need and deserve them. Thank you, Mr. Mayor.
Thank you, Councillor Davis, and Councillor Darren Roberts, please.
Yeah, thank you, Mr. Mayor. Like all members that spoke before me, I'm thrilled to see this come before council this evening. I fully support this report. You know, some people may have the means to be able to pay for adaptations to their property, but that doesn't mean to say they should, because, you know, having a disabled relative or child is not something that they chose. So having the necessary support, I think, is crucial. So quite honestly, I'm thrilled that the updated guidance from Welsh Government has come forward to allow this council to remove the means testing on these grants. So I, for one, will be supporting this evening with wholeheartedly. Thank you, Mr. Mayor.
Thank you, Councillor Roberts. Councillor Kevin O'Neill, please.
Yeah, thank you, Mr. Mayor. I'm again very pleased to see this. I'm in the middle of one of these DFGs at the moment with my constituents, and I'm delighted to see that this is on the agenda tonight. And I've already spoken to Suzanne earlier about this, so absolutely superb. The whole process was reviewed some time ago. If my memory serves me well, I think Councillor Amos, Councillor Roberts were all involved, and Alan Owen, and looking at a panel to sometimes judge some of those ones in need. I think that was an excellent process, and I only hope that the infrastructure and the logistics that run behind these grants is streamlined and dynamic, so those people who are in real need are not left hanging too long waiting for that support. A great step forward, and I just hope we can keep up with the pace of the demand that's ever growing. Thank you, Mr. Mayor.
Thank you, Councillor O'Neill. Are there any further comments? No one is indicating, so it's back to Karis for a vote then, please.
Thank you, Mr. Mayor. Can I ask all those members who wish to abstain on this matter, please show now. Thank you. All those members who wish to vote against, please show now. Thank you. All those members voting in favour, please show now. And that's carried, Mr. Mayor.
Okay, thank you very much. If we could all lower our hands then, please. And then we can move on to agenda item number 9, which is an information report. Item number 10 is to deal with any other urgent business or correspondence. There is none. And item 11, to receive communications from His Worship the Mayor. There are no communications. So that concludes the meeting. Thank you very much for attending, and I'll see you all soon.
Thank you, Mr. Mayor.